Pastor Chooks, along with his wife, Pastor Toyin, are the lead pastors of Resurrection Life Church in Johannesburg, South Africa. Through them, God is raising an army of ordinary men and women who are transforming and uplifting the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation and uplifting of the complete man, complete woman, and wholesome families. Some of the events and programs include the Dream Achievers seminars and conferences, Kingdom Financiers conferences, marriage enrichment courses and seminars, for wives-only seminars, single ladies boot camps, limitless men's seminars. They are also the founders of the Power of Woman Academy, a group mentorship for high-impact women. They also host the annual Power of Woman conferences and events. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Welcome, it's another Thursday evening and it is the Amazing Power of Woman broadcast. We are indeed very glad to have you join us for another amazing broadcast. My name is Toyin Ugoehe, and today, along with Pastor Chooks, my husband, we are your host for another Power of Woman broadcast. This broadcast is born out of the book written by my husband, The Amazing Power of Woman, where he shares some light from the Word of God about the power that God has given each and every woman, that God has made available, and we need to just tap into it and be able to maximize what God has already made available for us. And so that is what this broadcast is about. Every Thursday, we bring you things that will help you as a woman harness that power, know what that power is, and harness that power. And we speak to the body, we speak to the soul, and we speak to the spirit of a woman. And so once a month, we have what we call our Ask Your Gynae sessions. This is where we specifically talk into the female body. Just knowing about our bodies. A lot of us women just get scared about something or the other because we don't have the appropriate information or the appropriate wisdom around it. And so once a month, we bring on our guest gynecologist, and they are able to shed light, they are able to bring wisdom from the many years of their practice on what we need to know about our bodies, what we need to understand, how to care for it. And our specific title today, it's around the breast care, how to care for our breast, and how to know what is important regarding caring for our breast. So we will, Pastor Chooks and our guest doctor will be coming on shortly. Pastor Chooks is going to be taking that segment of the broadcast. And so along with our guest Dr. Gugu Gamete, they're going to be showing us a powerful session around breast care. Amen. But before we get into that, I have some exciting news. We have started a Telegram channel. The link is right there on the screen. See, if you want to be able to join that Telegram channel, it's t.me/Amazing Power of Woman. And what we want to do is to be able to bring whatever information we have around the things that will help you as a woman, for the married woman, for the single woman, for the engaged woman, for just any woman in whatever sphere you are in your journey, for parenting, just information, wisdom that would help you. And so that channel, if you're interested in anything that has to do with you being the best that you can be, that's the channel to join on Telegram. It's the Amazing Power of Woman. That link on the screen is how you can be able to link up to. It's a public channel, so you can just click on. Type out that link on your browser, and you'll be able to join the channel. And it's a fresh channel. We just want to be able to make available all the things, the resources we have for women. This broadcast will also be made available on that channel as audios. So if you need it at any point in time, you can go to the channel. You'll be able to access the audios of this broadcast. Also, our programs, when we have things, we can also be able to answer your questions that you have. Last Saturday, we had the For Wives seminar. Oh, wow, what a beautiful, beautiful time we had, where wives were able to learn wisdom about how to be a happy wife. It was such an exciting time. And we just thought we need to be able to walk the journey with as many women as they want to, bring in wisdom. Wisdom is the principal thing. We all need wisdom to be able to navigate through life, whatever seasons and seasons we are going through, whether you're married, you're single, you're a mother, different things that we go through as women, but we have the opportunity to learn. We have the opportunity to receive wisdom, and that's what this channel is going to be about: bringing wisdom, bringing resources, bringing information your way, being able to answer your questions. So please, if you would love to be part of such a community, please go check out our channel. Be a part, subscribe to our channel, and we will see you there. So without, we will be going now, getting on with the rest of the broadcast as we bring on Pastor Chooks and Dr. Gugu Gamete after the ad break. Thank you. Have a beautiful one with us this evening. Amen.
The Power of Women Academy is a group mentoring program for high-impact women. Women who want to change their lives and their worlds and move on to the next level. Power of Women Academy is aimed and tailored at unleashing the passion and greatness locked inside you as a woman as you walk the journey of life over the mentorship period with our team of distinguished and well-accomplished mentors from all walks of life. Our mentors are indeed destiny helpers. These mentors come to inspire you. They come to encourage you, to challenge you, to teach you, to stretch you, and to empower you. They are committed to helping you fulfill your highest potential and help you birth your wildest dreams that have been placed in you by God. For more information about the Power of Women Academy, please visit www.powacademy.co.za or for inquiries, call 064 200 154.
Right, on tonight's show of today is another edition of your Ask Your Gynae, and we have our dearly beloved obstetrician and gynecologist, Dr. Audrey Gugu Gamete, on the show again tonight. We've enjoyed her ministry. We've enjoyed the knowledge and the wisdom that she shares. She turns our show into a medical practice, and we are grateful for that. We have her on again tonight. Dr. Gamete, welcome to the show.
Good evening to our listeners and viewers. Thank you so much, Pastor Chooks and Pastor Toyin, for the invite tonight.
Amen.
It is always a pleasure to be with the ladies on Ask Your Gynae session.
Amen. All right. What are we talking about today? We are talking about, Dr. Gamete, tell us.
Yes, today is a very interesting episode. We are talking about breast, care of the breast, the boobs.
Oh, wow.
The woman, the actual
one.
Yes.
That's awesome. All right, take it away. Talk to us. Let's learn.
Okay, thank you so much. The breast is another part of the body that actually defines a woman. It's got very wonderful uses based on its location. It's got a cosmetic effect, which is how you look when you're properly dressed up with your lovely cleavage, or how you give nutrition to your children, for those who are breastfeeding, and also for sexual pleasure. Those are part of the few functions that I can mention for the purposes of this show for what the breast is meant to be. The good thing about it as well is that it is not only a structure that is unique to females only. It is a structure also that is unique, that's available with men. But with men, it doesn't mature to the size of what the female has. Hence, because we are empowering women, I will want to mention the other features or the other pathologies or the other issues of concern about the breast that pertain to both male and the female. I still say that if you do empower a woman, you are empowering the nation. Hence, I am going to cover both. There's something that is of significance about the location of the breast, that it is almost central to the thorax. That means that if there's anything that affects the breast, it is likely to spread easily to your brain because of the proximity between the breast and your brain. It is likely to affect your chest because of the proximity And also it is likely to affect the functioning of your heart. So if the breast is not well taken care of, or if there is a problem with the breast, it can present either as shortness of breath, it can present as chest pain, and you think that maybe you are having a heart attack. It can also present sometimes as a headache because of maybe tension around you having a very tight bra, affecting return of blood from the upper part of your body. So what is it that as a woman I should know about care of my breast? Number one, I think before I zoom in or home into the female breast, I'm just gonna say that the fact that the man also has breast, there are some genetic implications that can affect the male breast as well. So when we talk about the care, the same care that a woman gives to her breast, it is the same care that a male needs to give to his breast, more especially if there are genetic conditions that run in that family. Let me just brush through cancers. If there is a cancer of breast in the family, the male should be as equally vigilant in taking care of their breast. That includes examination. And if your body gains a lot of weight, which means that when a man develops breasts that are of a recognizable size, the care that he gives to his breast is more or less the same as the one he would that the female counterparts of the family would give. So what are the diseases or the conditions that affect the female breast? I've broadly categorized them into discharges, inflammatory, and the masses. The masses involve non-cancerous masses and cancerous masses. What are the discharges that we commonly see? Discharges from the breast can be milk, blood, or pus. For you to note that, you must be observant to the breast. Unlike the vagina, the breast is always dry. So once you see discharge on your underwear, that is your bra, there is something that needs to be attended to. So when do we see any of those discharges? Number one, the milk. In early infancy, the baby usually comes out with hormones from the mother. So the breast can feel like it's got a mass. And when you squeeze on the nipple, you can see a milk discharge. That is a common phenomena in the neonates. It does, however, settle as the baby grows. Then the second part, we see milk discharge from the breast. It is when a woman is pregnant or when a woman is lactating. Outside those physiological circumstances, then it is an area of concern to see your breast discharging milk. Why should you be concerned? It means that there is something that is behaving either like pregnancy or that is behaving like you are breastfeeding, that is giving out an instruction to your breast to give out the breast. And the common place is inside the brain. Most women will develop a tumor or a growth that is assisting the breast or that is instructing the breast to give out milk. I will expand around that when I talk about the masses. And then one needs to see the doctor if there is a discharge like milk on the breast outside breastfeeding, outside pregnancy, or if it is not a neonate. Then the second kind of a problem that we see as a discharge is pus. Pus usually comes out if there's been an inflammation inside. We call that an abscess. We commonly see that around the breastfeeding time or when a mother is weaning a baby off breast milk. That will be because the ducts that produce the milk get blocked. When they get blocked, then the milk becomes infected and it becomes pus. So that is an area of concern once you start giving out pus from your nipple. Number 3, if there is blood. Blood coming out of the nipple is almost always a very red flag. One needs to pay attention to that. Somebody would say, mine doesn't give out milk, doesn't give out blood, doesn't give out pus, but I just see water. A watery discharge can be sometimes relevant to your menstrual cycle. Remember when we said menstrual cycle, we said from the start of your period to the start of your next period. So one needs to observe when in the cycle do I get the secretion from the breast. If you are unsure about its significance, please do consult with your clinician for assessment and further advice on that. Those are the discharges from the breast. Then I go to inflammatory conditions. Inflammatory conditions, it could be feeling like the breast have swollen, or you see your skin on the breast changing its color to a reddish color, becoming hot, or you just see the skin on your breast looking like that of a skin of an orange or a skin of a lemon. That will include some inflammatory changes or swelling, which is edema. So in that circumstance, number 1, the swelling can be a result of a part of your menstrual cycle. Most women would attest to that. Actually, around a certain time of my period, usually from ovulation, the breasts start growing and they become tender. When you take them out of the bra, you feel like they are very sensitive. They are very painful when they start sagging. So that is a common phenomena. Then if you are breastfeeding as well, and one of the ducts get blocked, you will see that inflammation, your part of the breast becoming red, becoming painful, and maybe progressing to be an abscess. Then the last condition, it is when there is a cancerous growth. Some cancers, most of them, they will not be painful, but you will see the changes on the skin of the breast. Hence, it's very important that as a woman, you have a good-sized mirror where you can see at least half of your body. At any given point in time, you must stand in front of the mirror and look at your breast. Know what is normal about your body so that if there is anything that is abnormal, it is easy to pick it up and it is easier to act. And then the masses. The masses is a growth, any growth or lump that is detectable on the breast. Let me make an example. Around menarche, or when a girl slips into puberty, the breasts start growing. There is a feeling of a lump inside, and that lump is usually painful to touch. That is a common physiological move by the body. But if now you feel the breast, you feel like there's a tennis ball inside or there's a marble inside, that is abnormal. That is abnormal. Whether the marble is painful, whether the marble is soft, whether the marble is hard, it needs to be assessed as in what nature of a marble or what nature of a lump it is. There are ladies who say, I was told at the age of 15 that there's a lump on my breast. And after that, the doctor checked and said, there's nothing to worry about. May I caution you, wonderful sister of mine, any lump that you have on your breast needs to be surveilled. Surveillance means tracking its course, because at any given point in time, as you grow, it can change its nature. The change in nature can be brought about by hormones, can be brought about environmental changes, which include the food and so on. It can also be brought about by your advancement in age. Some of us will get disease conditions which will need hormones to be part of the treatment. Those hormones can fuel either the growth or change in the nature of the mass. So what am I saying? Any breast lump, regardless of when it has been diagnosed in your life, whether it has been biopsied and it has been proven to be non-dangerous or innocent, the fact that it is still in your breast, it needs to be surveilled or it needs to be tracked until your days on earth are done. Okay. And then, so how do you identify a cancerous mass? Oftentimes, there is nothing that will tell you as a woman that this mass is cancerous. Most cancers are not painful, and most cancers will never scream that I am there. The one time when we normally find a breast cancer, it is when you pick it up as a lump or when you just do your normal checkups. And in that time, when you do your normal checkups, you find that there is something that either looks calcified or something that either looks like it's just a shade when you look at it on the mammogram. And then when they further dig into that, they may find that it is cancerous. So it is very important that as a woman, you know your breast in and out. Okay, I'm gonna just try and display on how do you examine your breast as a woman. Breast examination needs you to stand in front of the mirror with no clothes on your thorax or on your chest, and you look at your breast with your shoulders relaxed, standing in front of the mirror. Physiologically, one breast will always be bigger than the other. Number two, one breast may be a little bit gravitating or facing down than the other. The one may be standing, the other one may be facing down. That is something that physiologically happens. Then you can lift your hands over your head like that, and you look at the breast. During that time, you're looking at the symmetry, as in how is one breast different from the other. Number two, you are looking for any lumps that stand out when your hands are up there. Number three, you're getting a chance to look under the armpits. Your armpits still form part of the milk line. The breast is somehow anchored under your armpit. So if there is any abnormality, it can track along the tail of the breast. We call that the lymph node supply of your breast. Okay, so that needs to be examined. If there is lump in your armpit, it is as good as a lump in your breast. If there is a lump that is not painful, that is sitting under your armpit, please make sure that it is checked out. If it is painful, most likely it is a node. There is some inflammation that's going on. So any lump under your armpit that is not going away, that is non-painful, but that you keep on being aware of it, please make sure that it is checked out, because it can be the tail of your breast. While I'm still there, who should be examining breasts and when should this start? I always say the earlier we teach our daughters to examine their breast, the more they are going to benefit from that. The best time to examine your breast is immediately after your menstrual cycle. When your breasts are relaxed, they are less painful. That's the best time to examine your breast. If you're unsure, when you get to your gynae, please do ask. For some reason, I was telling Pastor Chooks and Pastor Toyin that the breast was taken out of gynae care. So as a result, most gynaes will not touch your breast when you visit them. Please do ask, Doctor, may you please examine my breast, just so that you learn how it is done, and also so that you've got a second opinion about what you normally do. And this is a practice that we need to do every cycle. Every cycle. For those who have already menopaused, it is important that you just get to touch your breast once in a while so that you know what's happening or what are the new developments in your breast. And then care of the breast as well, apart from examining it or self-examination, involves wearing comfortable clothes. This is about your bra. Your bra plays a major role in supporting your breast tissue. This could be because of the size. This could be because of the shape. This could be because of cosmetics. We all want to look nice when we are dressed up. So it is important, number one, that when you get to the shop, please, ladies, don't be shy. Ask for the lady who is assisting in that department to, number one, measure your bra size. Number two, to assist you choose a cup that will suit the shape of your breast. Let me make an example. You love Wonder Bra. When Wonder Bra started, they had sizes up to a 34, or if there is a 36, it wouldn't be going up to a C, it will be going up to the B's. So now, because you love Wonder Bra, you love the style, you love the cleavage that shows, or you want to wear an evening dress, that bra is not going to support your breast. So it will look like a pudding or a muffin. You know, when a muffin rises and it spills over the sides of the pan, that's how it will look like. We can see where your bra is and the cup ends, and then there's the breast that's overflowing on top. It should look neat when you are dressed up. So that's why I'm saying get measured. Number two, find the right cup size and the right cup shape for the size of your breast. If your breasts are big, make sure that you accommodate them with the right size for when you are on your periods, where the breast size may sort of approach another cup size, or other people feel like their breast size double. So it's important that you've got a set of bra that you're gonna wear around the time when your breasts are a little bit bigger, or when your breasts have also shrunken. Number two, when you are nursing, wear the right bra for the nursing needs of your baby. A bra that is going to have pads, or where you will be able to add pads but still look comfortable in it, where there's going to be an ease of administering nutrition to the baby as it when it's needed, without feeling the discomfort of taking out the breast. I must say that the size, the shape, and the care that you give to your undergarment determines the life of your spine. So if you wear the wrong bra, maybe with thin straps, it's going to make imprints, heavy imprints on your shoulders. That will mean that you're gonna use your shoulder muscle to carry your breast. But if you've got a thick strap, sometimes it's even padded, it will distribute the weight of your breasts over your shoulders. And secondly, if you are changing weight, or if you are rapidly gaining weight, please don't be shy to change your bra, because that will give you comfort. So if your bra size is also, if your bra quality is also not a strong one, you'll find that your shoulders now compensate for the weight, and that is hurting your vertebra. In the long run, you'll find that your vertebra now becomes your backbone. That's the right one. Your backbone now becomes curved, and you've got difficulties maintaining posture. So a bra is very important in that regard. So that's how much you can do at home to take care of your breast. And then if you are of a certain age, currently in South Africa, we're saying from the age of 40, you must start doing mammograms. Mammograms can need a doctor's referral, or in some situations, you can easily walk into any center and get your mammogram done. That is to start surveillance for cancer diseases. There's something that I've heard women saying that a mammogram is painful, the breasts get ironed and so on. I don't know about that. But what I can say is if you choose a center that is used to doing mammogram, a women wellness center, a center that does purely mammograms, they get better in taking care of breast than when you go to a normal x-rays department where they are doing bones, they are doing skull, they are doing everything. So you will not get the attention that you need to do the mammogram. So a mammogram is a crucial detection tool for any changes that may happen on your breast at an early stage. So like I said, the current guideline in South Africa says from the age of 40, but we advocate that start from the age of 35, when your breast tissue is dense, doing ultrasound, doing sometimes mammograms, that is going to help to detect any changes before they start, and also to have a baseline of your normal breast tissue. Then for the women where you find that a family member has had breast cancer, it is advocated that you start at least 5 years before. Let me make an example. If I have a sister who gets breast cancer at the age of 30, that means that at the age of 25, I need to start my breast surveillance. The other factor that you need to take into consideration is if there is that cancer disease in your family, how fast from the time of diagnosis to the time of treatment, maybe to the time of demise of that family member or of extensive complications, how long was that period? That will help us determine on how progressive or how aggressive that kind of cancer was. And management in that is very, very crucial. The other part that I need to highlight about the start of mammogram is if a male in the family has had breast cancer, it is equally important for all members of the family, male or female, to start their breast surveillance early. That will be from around the age of 25. Then if there is a genetic, what we call BRCA1 or BRCA2, that is a genetic condition that can be easily picked up in family lines now, then that family needs to be exposed to a family counseling where the females usually are advised to have children very early so that by a certain age, both breasts get removed as a prophylaxis or as a preventative measure. Remember, breast tissue is just fat. So if we remove that fat on your chest, then we have prevented the disease before it starts. So what are the treatment options for all these things that I have mentioned? Number one, if it is inflammation, what we do, we just give you antibiotics, we give you anti-inflammatory, and we follow you up. If it is an abscess, we normally cut to drain the pus out of the breast. If it is a lump, you will be assessed by either a surgeon or a breast specialist. The radiological or the imaging will be the mammogram and the ultrasound, and then they will normally insert a small needle either to get some water or some tissue from that affected breast, and then they send that for tests to see, is it an innocent lump or it's a cancerous lump? Or than inserting a needle into that, they schedule an operation where the whole lump will be taken out for diagnosis, and also it will serve as a curative measure. Like I have said, if there is a lump that has been diagnosed in your breast, it is imperative that you follow it up for the rest of your life for as long as you have that breast with that lump on your chest. If it is a discharge, blood or milk outside the conditions or the physiological conditions that I mentioned, it is imperative to have an imaging to check. Do you have a growth in your brain that can be producing that impulse for your breast to produce milk? If there is a mass that is found, and it's so amazing that a mass as small as 1 millimeter or up to 3 millimeters can instruct the breast to produce that much milk. And those are the patients, or those are the women who will say, ever since I started seeing the milk, my periods disappeared. I am having headaches. I am having difficulty seeing. That is a sign that there's something that's happening in your breast, in your brain, that is instructing your breast to behave in that manner. Blood needs to be investigated. Usually what they'll do is they will squeeze the blood out of your breast, spread it out on a slide, and send it for tests. That can tell us, are there any cancer cells in that? Is it purely inflammation? And then if there is a cancer that gets diagnosed on your breast, it can be an issue of how far it is. Is it on the pipes that move milk, or it is in the fat tissue? Is it also in the tail or under your breast? Then also we want to know, has it made a visit to any other structure of your body, which commonly will be your lung tissue and also your brain? If it has made visits to those structures, then the staging changes. I will not dwell much into staging because I want to trigger questions from you, my dearest audience. So now, part of the treatment for breast cancer involves removing either the ducts that move the breast or the entire breast tissue. If that has been done, there will definitely be some discrepancy in the way you look as a woman. So sometimes they can, if you are well nourished like some of us, they can immobilize some of the fat tissue from the other parts of your body and bring it towards your chest to make your breast look more or less symmetrical. But if that's not the case, you may need to have what we call an implant. An implant is when now they put a balloon or a silicone-filled, what will I call it, cushion in your breast to help so that you have a symmetry in the way your breasts look. I'm not going to dwell much into that because I want to trigger some questions from you as well. And then there is a class, like I said, if there is a known genetic disease where now both breasts need to be removed, even if there's been no cancer diagnosed. Once the breasts have been removed, then we know that there is treatment. So before I sum up, for the male counterparts, it is the same treatment. They will also remove the entire breast tissue and leave skin on muscle on the males to make sure that the chances of the disease happening or recurring is completely removed. The small area outside cancers that I would like to include is about cosmesis. There are women who will say, my breasts are so small, I feel like I'm not a woman. What are the options available for those women? They can go for what is called breast augmentation. Breast augmentation can come in 2 ways. It can be the use of hormones, or it can be when we put those cushions to grow the breast. And once you have implants, still the care of your breast follows a similar one with the one who has not had implants. So you need to do mammograms, and when you get to your radiographer, you need to alert them that you have implants. Then there are those who have too big breasts to be comfortable. Maybe you can't even get the size of a bra to wear, or you have now back pain, backache because of the size of the breast. Those women can go through what is called breast reduction. There are medical aids that will pay for breast reduction. In the government hospital, it can also be done, as long as we can motivate that indeed the breast size is affecting your quality of life. Can I just stop there and say breast care is very important? It still forms part of women care, regardless of the fact that it's not something that your gynae will regularly examine, but as a woman, must know your breast is as important as your face. Thank you, Pastor Chubbs.
All right. Wow, thank you so much for, hey, you are just good at this thing. Thank you.
Thank you so much.
I have learned quite a bit to add to the one I know before now. Thank you. There are a few questions that pop in my head. I do know that the ladies who are watching also might have questions, and we'll be happy to take their questions. So if you do have questions and you're watching us, either watching on Facebook or on YouTube, please type it on the comment section, and we will get those questions and we would find a way to answer them. Please type your questions if you do have any questions. All right, but while we wait for your questions to come, Dr. Gomez, I have questions. What are the long-term effects of wearing the wrong size of bra on a woman? Long-term.
I've touched on a few of them, Pastor.
Yes.
It's breasts are about confidence. Honestly, I may not have the looks, but my bust can just give me the confidence. So if you are wearing the wrong size, or you feel you've got the wrong size of breasts, that can subtract something from your confidence. Secondly, if you are used to wearing the wrong bra size, you can have the back pain, you can have the shoulder pain, get treated for tension headache that is not leaving you, purely because of the wrong size of a bra that you are using, amongst the other things that can be. And then also it can be difficult now to know when there is something wrong that is happening, because it means that the only part of your breast that you know is the one that goes in the cup. The other part of your breast you won't have time to touch it because it doesn't even fit in the cup. There are some people who will wear the biggest cup so that it's spongy and so on. But if it's not there, like when I mentioned the choice of a bra, I said it involves the cup shape, it involves the cup size, and then also the circumference. So you can also, there are people whom you find having what we call spider nevi, like veins on their chest, purely because the bra is so tight, blood cannot move through, blood cannot circulate. You find black marks on your waist, because not on your waist, on your bust, because of the persistent tightening of the bra. Other people have got marks like they've been burnt because of the persistent pressure of the elastic on your skin. So skin conditions can arise from that. Also, if your bra is very tight, you find that there's no rebreathing, especially under your breasts. So thrush can grow under your breast. So you get a skin condition where the under part of your breast is very itchy because it's not well ventilated, amongst the things that I can mention.
Oh, all right, thank you. I think we're gonna have another show on the amazing power of women, where we're gonna talk about bras and choosing the right size of bras, and we're gonna get a bra expert to come and talk about it. Yes, cup size, cup shape, and the circumference, and being able to know your size, because I see a lot of people wear things that are not their size, And
in the shoulder strap, Pastor Chu.
yes, and the shoulder strap as well. Yes. So we will have that show in a short while from now, where we're gonna bring someone who understands it very well to throw light. Unfortunately, it's amazing that there are no talks for ladies around this thing, and yet people wear bras every day, and there's no one that teaches on right size and knowing what is good for you and what is not good for you. And yet this is something that all women sit with every day. So
if the big sister got it wrong in the family, we will all get it wrong. If mommy got it wrong, we will all get it wrong.
Exactly. So we will address that concern. We will have a show to address it. All right. You touched on boob jobs, whether it's breast enlargement or breast reduction, and so on. A lot of women are insecure around the size of their breasts, and there are a number of people who either it's too big and they want to go take it down or make it smaller, or it's too small and there are all kinds of things in the market that are there. Can we talk about this confidence issue? Can we just address it a little bit?
I come from the Swazi culture where breasts are a big thing. When we have our celebrations, our dress code is such that as a maiden, your breasts are exposed. So shape is a very big thing, to the point that if they see your breast a certain shape, they can associate it with you've already breastfed a baby, you are already sexually involved just from shape. And most of our African cultures will look at your breast and judge whether you've been sexually exposed or you've breastfed. So as a woman,
is that accurate though?
Pardon?
Is that accurate though?
No, it is not accurate.
Okay.
Breast tissue is a function of your collagen structure. If your collagen structure is not as strong, they will gravitate. There's girls right from the age of 15, their breasts are facing down, like pawpaws on a tree. And then there are those who have breastfed 3-4 children. Their nipples are still as pointy as stones, rosy stones. And so it's mainly about your genetic makeup than your exposure to certain things. So growing up under that kind of culture and image around breasts, there's a lot attached to how your breasts look. So image comes from how am I perceived with the size of my breast or with the nature of my breast. I haven't mentioned the topic of what they call transgender and all the other things that I will reserve for a certain for a certain audience. But for the purposes of the amazing power of woman, we've already classified you, listener, as a woman. That's why we're not talking about transgender issues. So if your breasts are smaller, then you will want them to be bigger to look a certain way. If you've got bigger sisters with bigger breasts, you'll want yours to look bigger. If you've got bigger sisters who are struggling with bigger breasts, you want your breasts smaller. If you've got breasts that are sagging and you're the only one in the family, everybody has got pointy nipples, you'll want a job to make sure that your breasts look a certain way. So there is a lot of image issues attached around the breast. Hence, I feel, Pastor Chooks, that the issue of bra enhances your image as a woman. If you've got a beautiful padded bra that's gonna boost the size of your bra or boost the shape of a bra, you are as good as the woman who have got pointy nipples and who don't need a bra.
Okay. All right, there's quite a bit to talk about, but we've run out of time. We've run out of time. I would want to believe that Dr. Gameze will have you on again to trash out this topic, and especially with the questions that the ladies may have. Possibly on the day we get the bra fitting expert. And then we will, address some of the questions that are coming up now. But our time is up. We can't continue. Well, thank you so much again for being our guest tonight and just helping us throw light from a medical perspective on the issue of breast care. Well, to all the ladies there, you've heard Dr. Gameze. If you do need medical attention, like we always say, please do contact us on the number on the screen. That our number +27 8142100835. We'll be happy to send you Dr. Gameze's practice clinic number so that you can make a phone call and make a reservation or make an appointment rather to go and see her. It's very, very important that you do that. If you need any kind of medical attention, she is willing and happy to see you. So just send us a message and we'll be able to direct you properly. Dr. Gameze, thank you so much again for tonight. Any last final comments before we wrap it up for tonight?
Thank you so much, Pastor Chooks. It is always a pleasure talking to you, amazing women. And yes, we've got the power to transform ourselves, the power to transform our society, and our breasts form part of our womanhood. Let's embrace them and let's take care of them. Even in menopause, when they are really sagging, they even lost their shape, they still need to be taken care of. Till we meet the next time. Thank you. All
right. God bless you, Dr. Gameze. Ladies, we are just grateful to just have Dr. Gameze on the show every time on Ask Your Gynae. Well, tonight we thank God for all that we have learned. We are happy to take more questions the next time we will have an opportunity. So if you've sent your questions or you do have questions, please send them, put them on the comment section. We'll harvest them and we'll deal with them next time. Until that next time, good night and God bless you. We'll see you.
The Power of Women Academy is a group mentoring program for high-impact women. Women who want to change their lives and their worlds and move on to the next level. Power of Women Academy is aimed and tailored at unleashing the passion and greatness locked inside you as a woman as you walk the journey of life over the mentorship period with our team of distinguished and well-accomplished mentors from all walks of life. Our mentors are indeed destiny helpers. These mentors come to inspire you. They come to encourage you, to challenge you, to teach you, to stretch you, and to empower you. They are committed to helping you fulfill your highest potential and help you birth your wildest dreams that have been placed in you by God. For more information about the Power of Women Academy, please visit www.powacademy.co.za or for inquiries, call 064 200 1545.